Welcome to Virtual Family Training for Immigrants. The instructors in the Finnish Virtual Family Training are Public Health Nurse Jasmin Kaljadin and Peer Instructor Kela from Albania. This virtual family training is part of the peer-based family training model for immigrants of the Need to Project, which is coordinated by the Tampere University of Applied Sciences with the City of Tampere acting as its partner. The project is funded by the Asylum, Migration and Integration Fund, AMIF. It will run from 2018 to 2020. This section of the family training deals with the science of labor and drug-free pain relief methods. We hope it will provide you with useful information on your journey towards the birth and your everyday life with your baby. Labor begins with contractions or with your waters breaking. Contractions cause waves of pain. Like a wave, a contraction gets stronger until it peaks and then starts to subside. You may feel the contractions in your abdomen, the back, or your thighs. Contractions may at first be less frequent and they may also stop completely. At the beginning, contractions may be irregular and this may continue for several hours or even days. You have gone into labor when you have had painful contractions for 2 hours and they come at least every 10 minutes. A woman who has had a baby before may go into labor considerably quicker. That means that it may be best to go to the hospital sooner. How far apart your contractions are is calculated from the beginning of a contraction to the beginning of the next one. In the early stages of labor, it's safe and most comfortable for you to be at home. You should go to the hospital at the latest when your contractions come 5 minutes apart or you no longer feel safe at home. You can always call the hospital and ask for advice if you're not sure if you should go to the hospital or stay at home. Labor can also begin with your waters breaking. The waters, also known as amniotic fluid, are the fluid inside the womb, protecting your baby. During labor, the membranes of the amniotic sac that holds the amniotic fluid rupture and the amniotic fluid leaks out via the vagina. This is your waters breaking. Normally, amniotic fluid is colorless or slightly pinkish. Your waters may break in a gush or in smaller trickles. Contractions usually begin within 24 hours of the waters breaking. If the amniotic fluid is a normal color, the pregnancy has been normal, the mother feels well and feels the fetus movements as normal. It's usually safe to stay at home to wait for the contractions to begin, but for no more than 12 hours. Different hospitals have different guidelines for when the waters have broken. Check the instructions of your hospital or maternity clinic. There may be some situations at the beginning of labor when you should go to the hospital immediately. When labor begins, there may be slight bleeding from the cervix, which is normal. If there is heavy bleeding, call the emergency number 112. During labor, it's important to monitor the baby's movements. You should feel at least 10 movements an hour. If you feel less than 10 movements an hour, continue to monitor them for another hour. Before you start counting them, you should drink something cold and sweet and move about a little. If you feel less than 10 movements during the second hour, go to the hospital immediately. Normally, amniotic fluid is colorless or slightly pinkish. Usually, a woman in labor can stay home for approximately 12 hours after her waters have broken. Check the guidelines of your hospital and follow them. If the amniotic fluid is brown, green or bloody, go to the hospital immediately. A contraction usually lasts about 30 to 60 seconds, but can last up to 90 seconds. Sometimes it can feel like a very long time. If the pain from a contraction feels like a continuous pain in your abdomen and doesn't ease off like a normal contraction, go to the hospital immediately. If you have bloody discharge and or a strong non-stop pain in your abdomen, you must immediately call an ambulance to take you to the hospital. The following sentences are peer instructors' personal experience. It was easy to recognize the beginning of labor because the contractions hurt a lot more than the contractions I have had earlier in my pregnancy. Your body will tell you when labor has begun. Often, home is the most comfortable place to be. If your contractions are not frequent, it's not worth going to the hospital yet. The delivery may take a long time, and it's best to be patient and prepared for that. In the early stages of labor, it is safe for you to be at home. There are many ways to ease the pain of contractions at home. You can use these methods also in the hospital. Relaxation is an important part of pain relief. You can use music, lighting, sound, and movement to help you relax. Breathing is another important part of pain relief. Breathe calmly during contractions. Before delivery, it is a good idea to learn about relaxation and breathing techniques together with your partner. Often, bending slightly forward and making small movements will feel like the most comfortable position. An upright position helps the fetus to move lower in the womb and helps the cervix to open. Try to move as much as you can. For many women, heat during labor feels relaxing. For example, a wheat bag that's heated up in a microwave is often a great help. Cold therapy may also feel comfortable. You can use, for example, cold gel packs or a towel dipped in cold water. Many women find that warm water helps with the pain. You should stay at least 20 minutes under the shower or in a tub to feel the effect. Touch and massage help many women to relax and to feel less pain. Your support person can massage you where you have pain or gently press on the pain spots. A TENS machine is a good method for pain relief for many women. Through electrodes that are tapped to your back, it sends small, safe amounts of current that prevent pain signals from reaching your brain. Check the instructions that come with the machine for pictures of how to attach the electrodes. You can buy a TENS machine or borrow one. Ask your maternity clinic where you can borrow a TENS machine. At home, you can also take a maximum of 1 gram of a painkiller containing paracetamol 3 times a day, which means about every 8 hours. Don't forget to rest every now and then. You can take one support person with you to the delivery. Often, this person is the pregnant woman's partner. A child's birth is a unique experience for both parents, which is why we recommend that your partner comes with you. Then both parents can become acquainted with their baby straight after birth. The support person can also be someone else who is close to you. You can't take children along to the hospital. The support person plays an important role during delivery. The support person's presence is reassuring for the mother and brings her a sense of security. The support person can ease the mother's contraction pains by helping her to find a comfortable position. stroking and massaging her and gently pressing her pain spots. As well as pain relief, the support person can make sure the mother eats and drinks something and feels able to cope and carry on and encourages her at different stages of labor. The support person also needs to take care of their own ability to cope and carry on. Before delivery, it is a good idea to discuss what the mother's wishes are for the support person during labor. Some women like to be touched during labor, while others don't want to be touched. The following sentences are peer instructors' personal experience. In many countries, the father doesn't necessarily accompany the mother in the delivery room, but in Finland we recommend it. The father is usually the best support during labor, but it's important to ask the mother who she would like to have with her during labor and what she wants the support person to do. Always take the following items to the maternity hospital: maternity card and an identity card with your photo. Any medicine you take regularly. Personal toiletries such as a toothbrush, toothpaste, deodorant and shampoo. If you want, you can also take the following: clothes and indoor shoes, if you prefer to wear your own. Otherwise, you will be provided with clothes and indoor shoes at the hospital. Packed lunch for the support person. Relaxing music and your own headphones if you want. A camera if you want to take photos of the mother or the newborn. Please note that you're not allowed to take photos of any other people or members of the staff without their permission. It's best to leave your valuables at home. We recommend you pack up a bag ready for the hospital during the last few weeks of your pregnancy. That means it will be easy to take along when you go into labor. We recommend you pack a bag ready for the baby too, but don't bring it to the hospital until the day you and your baby are discharged. The baby will only need clothes for the journey home. If you intend to take your baby home by car, you will need a baby car seat. When your contractions come frequently and are painful and you no longer feel you can cope with the pain at home, it's time to go to the hospital. Find out what your own hospital recommends about going to the hospital. Many hospitals organize tours of the maternity ward that you will be invited to during the last weeks of your pregnancy. That way you will learn the route to the hospital and the ward, and the hospital facilities will be familiar to you. The exact date of your delivery can't be known beforehand. That's why it may well be challenging to get an interpreter to accompany you at the hospital for the duration of the birth. We recommend you talk about your wishes at the maternity clinic beforehand and ask, for example, the nurse to write down your wishes. Childbirth is a natural event and the majority of deliveries go very well. Trust yourself. Professional midwives will help you throughout the delivery. It's natural to be nervous about childbirth. This is a topic that the nurse at the maternity clinic will talk to you about. If you have any questions about the topics discussed here, please talk to your public health nurse at the maternity clinic. We recommend you also see the other videos and brochures produced within the Need to project. Some of the videos are available with Finnish, Arabic, English, Persian and Somali subtitles. Some of the brochures have been translated into Finnish, Arabic, English, Persian and Somali. The employees of the Need to project wish you a happy pregnancy and all the best with your delivery.